Hi guys, this week we're adding to your head to toe assessment. Last week we showed you the general survey and vital signs. So this week we're adding on to that a neuro assessment and the head, ears, eyes, nose, and throat assessment. For the neuro assessment, first you inspect the patient's face. You're looking for symmetry. Does it look the same on both sides? Is there drooping on one side? Next, you're looking at their mental status. You ask those silly 4 questions to see if they're oriented to time, place, themselves, in the situation. Next, you're looking for sensory deficits. So can they feel you touching them equally on both sides? Look at them when they walk. If you have them walking onto the bed, you can watch them and watch their gait. Are they unsteady? Are they steady? Do they need an assistive device? Check their reflexes. Can they push down on your hands, pull up on your hands? And then a most important thing is a pain assessment, and I'll go into further detail with that later. Next is the head, ears, eyes, nose, and throat. So obviously you want to inspect all those, the mucous membranes in the mouth and the nose, make sure they're not inflamed. Check their eyes for symmetry. Their nose should be midline. Check their eyes for perla. So are their pupils equal, round, reactive to light, and accommodating? Can the patient smile? Can they stick their tongue out? Does their tongue deviate to one side? They should be able to move it around, and they should be able to follow your finger with their eyes. Check their carotid pulses. Don't do it both at one time, or else you'll clog them and they can pass out. Just do one at a time and just make sure there's one equally on both sides. Check their hearing and vision. I'll show you that. There's a vision chart and also the whisper test for hearing. And let's get into it. Hi, I'm Sydney. I'm going to be your student nurse today. How are you?
I'm doing good. How are you?
Good. Can I check your wristband? Can you state your name and date of birth?
Yep, my name is Liam Gilligan. My birthday is October 12th in 1999.
Perfect. All right. And what seems to be the problem today?
I'm having some ankle pain. I sprained it a couple days ago.
Okay. So has the pain been continuous?
Yeah, it's kind of been getting better. It's been getting better since, but...
All right, and on a scale of 0 to 10, how severe is the pain? 0 being no pain at all, 10 being the worst pain you ever felt in your life?
I'd say it's around a 6.
A 6? Okay, have you been taking anything?
Yeah, I've been taking Tylenol.
All right, is there anything else that helps kind of relieve that pain?
I've also been icing it and then just kind of elevating it with like a couple pillows.
Okay, does anything make it worse?
When I have to like walk or put any pressure on it, really.
All right. So just by having this conversation with Liam, I know that he's in pain. He thinks he might have maybe sprained his ankle. His hygiene's good. He doesn't have any strong odor coming off of him. He has good dentition if he smiles. His outfit's appropriate for the weather. His speech is clear. He can have a conversation with me. He has a good affect, and he has no tremors. So next I'm going to take vital signs on you. I'm going to have you stick this under your tongue. Oxygen's 97, heart rate 75. This one. You can relax that arm, and then make sure to always do a 2-step blood pressure. 120/80. And he's breathing at a normal rate. His respirations were 16. Just one look at your hands here and your feet. So he has 10 fingers, 10 toes. Next, I'm just gonna listen to his heart and lung sounds. Obviously, we're gonna add the more in-depth in your next few videos, but right now, just to listen to hear what they sound like. And can I just sit up for a minute?
Yep.
Perfect. So there are different words used to describe a patient's level of consciousness. The first is alert. That's if the patient's awake, you can easily arouse them, they're oriented to themselves, the place, their situation, and the time. Next is lethargic, so they're a little more difficult to arouse. Sometimes they're a little drowsy, and like their thoughts kind of take a little longer to come, but it's still like appropriate enough that they're still like oriented. It just takes them a little longer. Another is obtunded, which they just kind of are sleeping most of the time, and when you arouse them, they're a little more confused and they have that mumbled speech. Next is stupor, which is like semi-comatose, like you have to vigorously shake and move this patient to try to get them awake, and they're pretty much nonverbal except they moan every here and there. And the next is unresponsive, so they are completely unconscious, like they don't respond to pain, so if you do like a sternal rub, they don't respond to it. And then another is delirium. So if a patient is detritus delirious, they're extremely confused, they can be violent, and their speech is usually incoherent. Next, we're going to check to see if Liam's alert and oriented to himself, his situation, the time, and where he is. So we know Liam's oriented to himself. He was able to state his name and his date of birth. So do you know what the name of this building is?
Yeah, this is Wildcat Clinic.
Yes. Do you know what month it is?
Yes, the month is September.
All right, and do you know why you're in the hospital?
Yes, this is because I think I sprained my ankle.
Perfect. So we can determine that Liam is alert and oriented ×4. Another part of the neuro assessment is describing and evaluating a patient's affect and their mood. A person's affect is their visible reaction, so what you as the nurse can see. So a patient can be pleasant or calm or flat. Flat is that more like emotionless. Mood is what the patient is feeling, so their underlying feeling. So some words to describe a patient's mood might be happy or euphoric, anxious, depressed. And for both of those, you really want to avoid the word normal, because everyone has their own kind of basis of what normal means, so it depends on the person. Next, in the neuro assessment, you want to assess the patient's sensory functions, their coordination and gait, and their muscle tone. So as for Liam's gait, I watched him walk into the clinic, and his left ankle, which is potentially sprained, he kind of limped on that side, so he favored the right. So his gait, I would say, was slightly unsteady and not at his baseline. So next, Liam, I'm gonna have you see if you feel equal on both sides. Can you feel me touching here?
Yep.
Down your arms?
Yes.
And down your legs?
Yes.
So Liam should feel me touching him on both sides equally. Next, I'm gonna have you close your eyes and tell me which side, what extremity I'm touching, and what side it's on.
Okay. My left arm. My right leg. My left foot. My right arm.
Perfect. So you know Liam can feel where we're touching on his extremities. And next I'm gonna have you stick your hands out push up on my hands. Good. Push down on my hands. So Liam's, both of his hands bilaterally have 4 out of 4 strength, which is the highest it can go. And if they have any deficits, you just kind of subtract it from that. Can I have you push up on my hands with your feet and then push down with the gas pedal? Perfect. So Liam's left foot, is a little not as strong as the right. So I would call the right 4 out of 4 strength and the left more 3 out of 4 just because of that ankle. Next, I'm going to perform the head, ears, eyes, nose, and throat assessment. So for this, you feel down the patient's scalp and check for any abnormalities. While you're doing that, you're assessing and inspecting for symmetry of the eyes, the ears, the nose is midline. Move down their neck and you're checking for lymph nodes, and then kind of assess their eyes. So first, I'm going to feel around his head, check his skull. He doesn't have any lumps or bumps or anything. Everything feels normal. Going down, checking his lymph nodes. No lymph nodes should be palpable. And if you do, that's something to report. His face is symmetrical. His eyes are equal. His nose is midline. His ears are the same height on both sides. And then I'm gonna have you take your glasses off. So make note that your patient is wearing glasses. And I'm gonna have you look forward. I'm gonna shine this light. So look straight ahead. So you want to look at the eye first that you're shining the light in, and then check for the next eye. Once you shine the light, the pupils should both constrict on both sides. And then you do it again on the next eye. So watch the light eye and then watch the next eye. Perfect. So his pupils both reacted to the light. Then I'll have you follow my finger. Perfect. So with that, I make an H movement, and you just want to make sure the patient holds their head still and they can track your finger with their eyes. And when you bring it close, you kind of look to see if the pupils their eyes are coming together. I can look by noting that his sclera is white. If I pull down his eyelids, they're not pale, they're pink, they're moist. And you don't want to see any like jaundice, which is that like orangey color in the eyes. Next, I'm going to assess the patient's ears, and I'm going to do this using what's called an otoscope. So make sure you always get a new cap for it, put it on in between each patient. And so when I do it, you have to press the button, turn it, and it turns on a light. So since Liam is above the age of 3, you take the pinna of the ear, which is the top, and pull it up and back. For younger kids, you would pull it down. So when I look in his ear, I'm looking to see if there's any obstruction, checking to see if the mucous membranes of the ear are pink. The eardrum should be like a pearly white or a light gray in color. Perfect. And you also want to note if there's any cerebrum or the earwax in the ears as well.